We are joined by Dr. Timothy Quinn. Dr. Quinn, thanks so much for joining us here on 12 News at noon. Now, what causes holiday depression?
I mean, Tyler, there are a lot of causes. I mean, the holidays are associated with getting together with family and friends and just having wonderful, loving times. But then there are those that might not be able to be joined with their family and friends for various reasons. Well, this could lead to someone having depressive symptoms or even depression. And then those that already have underlying depression, well, the National Alliance of Mental Health Illness noted 68% of people with pre-existing mental health issues such as depression have exacerbations or worsening during the holiday season. And a lot of this is due to the fact, as I said, maybe they can't be with family and friends, which can cause depression, or maybe they're already somewhat depressed, and the holiday season, with all the expectations, the getting together with people, maybe bad experiences in the past, well, this could make it even worse. But the take home is it's something that we really need to be aware of.
Absolutely. And so then what should someone do, Dr. Quinn, if they are feeling depressed?
Well, the first thing and the most important thing is don't hide it. Let someone know, because depression can be very dangerous. There are a lot of things that depression can lead to, but the most worrisome is someone could actually take their lives or even a life of someone else. So if you're having symptoms of depression, such as feeling sad, decreased energy, just decreased motivation, don't want to go anywhere, crying spells, it's a good idea to go ahead and share that with someone and get some help, because help can be very effective, but you have to let someone know.
All right, absolutely. It's good to talk about it with someone. Now, Dr. Quinn, what do we need to do if we see someone who is going through holiday depression?
Well, we have to be a buddy. We have to look out for them. For instance, if you have a grandmother and, she's saying, because this past Christmas was on Sunday, and she says, I just don't want to go to church. I just don't want to be around people. Well, that person is acting different than they normally do. And this is a very telling sign that they could be suffering from depression. You want to pull them to the side and say, are you okay? And if you have any index of suspicion, maybe schedule an appointment with their medical provider. They don't necessarily have to go see a therapist or a psychiatrist, but they can go see their primary care physician or their nurse practitioner. And then we, as primary care providers, we know how to ask the right questions and get them the help that they need.
And I know you mentioned this before, but with depression, talk to us briefly about seasonal affective disorder.
Right. Now, that's very relevant, and it's very common. During this time of year, there's decreased hours of sunlight, and it can interfere with our what's called circadian rhythm, meaning that when we have less sunlight, we produce a different level of melatonin that could lead to depression, and it's very, very common. But the good news is there is treatment. Some providers can use what's called the light therapy, where they are exposed to high levels of light throughout the day. But also there's certain medications, such as your SSRI or your serotonin reuptake inhibitors, such as your Zoloft or your Paxil, are very effective for this condition. But the most important take home is if you or someone you love or someone you know at work is experiencing any symptoms that suggest that they're acting blue or down, not happy, talk to them, pull them to the side and really ask them, are you okay? And if you suspect that they need help, get them a medical evaluation, because the consequence could be they could take their life.
Right, absolutely. All good tips. Thanks so much, Dr. Quinn, always for joining us.
Hey, thank you.
And that was Dr. Quinn with Quinn Healthcare.